Okay, hi Riley. I hope you're doing great. I'm gonna do a video now answering your questions, and I will make them into small videos so that they send more easily. So the first question was, what inspired you to pursue nursing, and what drew you specifically to dermatology? So in terms of pursuing nursing, when I was like 7 or 8 years old, my mom was diagnosed with ovarian cancer. And I spent a lot of time in the hospital with the nurses as my mom was there for several weeks while she was having her chemotherapy and surgery. I remembered the compassion, kindness, and attention they gave to my mom, and I idolized them. My mom had to have her ovaries removed, and after surgery, she developed an infection and she got very sick. It was the nurses that alerted the doctors and explained how sick she was and how they needed to come right away. And they did. They saved her life, as the surgeon had left gauze inside of her abdomen and she would have died if the nurses hadn't acted so quickly. So growing up, I always wanted to be a nurse. I wanted to be just like the women that took care of my mom. Um, and what drew me specifically to dermatology, um, when I became a nurse, I worked at Johns Hopkins. I worked on a medical surgical floor that did GI surgery, vascular surgery, and kidney, liver, pancreas transplants. And those patients got really sick and didn't end up doing very well. I mean, a lot really did well, but there was a lot of, not a lot of death, but after a while, that sort of gets to you a little bit. So when I finished up my NP degree, there were 3 different jobs that were available. One was on the transplant floor that I worked on. One was a cardiac surgery job, and the other one was a plastic surgery job. And so I chose plastic surgery because I thought that sounded a little bit more upbeat than the other 2 departments. So I took a job in plastic surgery. And then just to continue from there, I took a job in plastic surgery. I worked in the Department of Breast Reconstruction. And at that time that was happening, when I had that job, Botox Cosmetic had just been FDA approved. And I remember talking to my peers and my bosses about it, and we were saying about how when the residents finished their training at Johns Hopkins in plastic surgery, they would need to know how to do Botox and fillers and those things, because it was going to be something they were probably going to be doing when they finished their residency. However, no one in our department knew how to do it. So the doctors sort of came to me and said, well, if we send you to learn how to do Botox and fillers, will you then come back and teach the residents at Hopkins on how to do it? And so I was like, sure, okay. And so I did that, and I did a lot of, not as much as I do now, but I worked in the Department of Breast Reconstruction. And so doing the cosmetic Botox filler stuff was just sort of a small portion of what I did, because we developed a clinic where we offered it to patients for a really reasonable price, because we were all just learning how to do it. And so I did that for a while, and then I got pregnant with Benjamin, and thought I wanted to be a stay-at-home mom. So I quit my job to be at home with Benjamin I was home for about 6 months. And then I realized that I wanted to do something part-time. I kind of just needed to do something outside of the home, just part-time. And so a friend of mine was doing aesthetics in Georgetown in DC, and she was leaving to do a fellowship in New York. And so she reached out to me and said, hey, they need somebody 2 days a week to do Botox and lasers in DC. Do you want to do it? And so I took that job, and that was like 15 years ago. Well, Benjamin is 18. So that was about 17, 18 years ago. At what point did you decide to become a nurse practitioner instead of another nursing path? I had worked as a nurse at Johns Hopkins, right out of school, for a couple of years, about 3-4 years, and had moved up the ladder, to a level 3 nurse, which was sort of like the highest. I, at that point, as a nurse, working on the same floor, you really get good at taking care of the kind of patients you're taking care of. And I just remember feeling like, I wanted to have more autonomy. I wanted to make more decisions because at Hopkins, there's a lot of residents and they're kind of learning too. And the nurses end up being the ones that the residents are like, okay, what do I do? There's this kidney transplant and they have this infection. What do you do? And the nurses are the ones that, they know what to do because they've been seeing these patients all along. So um, I started to really enjoy being asked what to do to take care of these patients, and I wanted to have more autonomy. I also worked with a bunch of nurse practitioners on my unit that I really liked, and so I thought that would be a great job for me. What kind of education and certifications did you need to become a dermatology NP? So before you're an NP, you have to become a nurse, and that is a 4-year undergraduate degree. That's a bachelor's in the science of nursing. That's what the bachelor's degree is called. And then in order to become a nurse practitioner, it's a master's degree. So it's either 2 years, 3 years, 4 years, depending on how long it takes you to do it, what kind of pace you do it at. And then when you decide to become a nurse practitioner, you have to pick what kind. So do you want to be a pediatric, a adult, and acute care, meaning do you want to take care of people in the hospital? Do you want to do neurology? Like, you can kind of pick what kind of nurse practitioner that you want to become. And I chose to become an acute care NP because at that time I was working in the hospital and kind of thought I would always work in the hospital. So I became an acute care nurse practitioner. How do you stay up to date in such a fast evolving field? I read a lot of journals, specifically one of my favorite journals is the Drugs and Dermatology Journal of Drugs in Dermatology. I really like that journal. I also go on social media, a lot of ChatGPT, colleagues, word of mouth. I try and go to conferences. It's been harder for me to go to conferences lately just because I'm trying to run a business. And so being able to be away is tough, but that's kind of how you stay. You kind of keep your finger on the pulse in those ways. Owning a practice is a huge leap. What motivated you to open your own clinic? I have been working in aesthetics for about 15 years and I just wanted to sort of call my own shots. I kind of knew what I was doing. I wanted to be able to hire, people around me that I really liked, and I thought were hard workers. And I wanted to create a specific environment. And I realized I could only do that if I opened my own business. So I wanted to open a practice that felt kind of spa-like, but also was very medical and professional. So a lot of offices I had worked in, the offices weren't pretty. They were kind of sterile looking. They kind of look like what you would picture like your primary care doctor's office looking like. But I kind of felt like I wanted to look a little bit more polished because the patients that we see in aesthetics, we don't take insurance. And the procedures that we do run quite high in cost. And so I always kind of felt like, oh, if we're offering these services that cost a lot of money, why don't we have like an office that looks pretty and offer them nice water and make them feel like a little bit more pampered, but still make it professional and not just like, like a regular kind of spa where you would go get a massage or something like that, just something a little bit more elevated. How do you balance your business with having a family? It's an ongoing learning experience. It's definitely a lot. If I have to be totally honest, I kind of feel like I'm half-assing most things in my life. If I kind of step back and look, I'm like, oh, I could always be reading more journals. I could always be volunteering at Brindley School more. I could be taking them on more vacations. I could be, exercising more. I could be cooking more homemade meals. And so it's just, I can't be all those things. I think that's something that I knew when I opened my own business, that that would just get tougher. And I think it was just something that I came to realize can only do so much. I'm only one person and I just kind of do the best I can every day. And I can't always make everybody happy. Something always kind of falls short, but I just kind of spend the next day trying to spend more time with the things that I couldn't the day before. And I, I know that I'm working on building something that hopefully my family can enjoy in the future, whether it's how I retire, whether it's, Brinley coming and working with me, or Benjamin. Um, um, I balance it. I work really late on the days where I don't have my kids. So on Wednesdays and Thursday nights, I see patients until 7 or 8 o'clock. Mondays and Tuesdays, I only see patients until 3, so that I can be home when the kids get home. Or I can use those days if I need to go to their meetings or sports stuff. And I just try my best, and I just tell myself every day that I'm doing the best that I can, and it just has to be what it is. Okay, next question. Walk us through a typical day for you. Typical day is I'm up at around 5:30, 5:45. I get the kids to school, shower and get to work. I see patients from about 9 to 3 or 4 Mondays and Tuesdays, till 7 or 8 on Wednesdays and Thursdays, and till 5 on Fridays. Go home after work, basically order food. I don't cook. That's definitely an area that I've had to give up. So we try and order healthy salads and soups and, protein, chicken bowls, stuff like that. And then after dinner, I just kind of catch up on emails and admin stuff while the kids do homework and shower. And then I'm usually in bed by 11:30. How do you manage emotionally challenging cases like severe skin conditions or long-term treatment plans? For me, I only see cosmetic and aesthetic derm. So thankfully I don't have to, work with patients with unfortunate diagnoses or do really painful procedures. Because I'm in aesthetics, a cosmetic dermatology, I guess, if you will. I don't see any skin cancer or rashes or anything like that. I just do procedures and see patients about their skin. That's all sort of out of pocket. So thankfully, I don't have to, remove any skin cancers or, diagnose anybody with melanoma or do any Mohs surgery or anything like that. What skills are essential for success in dermatology, both character-wise and academic-wise? I think the most essential thing for success in derm is, when you go to a dermatologist, it can be a very vulnerable experience for patients, because it's not like you're going to the doctor and you're like, my appendix hurts and it has to come out, or, my blood pressure is up. How do I manage my blood pressure? Patients come to my office and they talk about their appearance, and that can be really difficult for people and make them feel very vulnerable. So the most important thing is to make patients feel comfortable, so that they can talk to you about their appearance, whether it's their lines and wrinkles or their acne scarring or their acne, moles that they don't like, the color, the discoloration on their skin, redness, rosacea. And so just being a good listener, being compassionate, I think being relatable, so that patients feel comfortable with you and tell you all of the things that are bothering them. And then this way you can develop a plan that sets you both up for success, that makes the patient happy because you really know what's bothering them, but then you can also set realistic expectations with them because they've shared with you what truly bothers them. And then academic wise, I think, it's very competitive to be in dermatology right now. So I think you have to really want it. I think you have to be a go-getter, and do things in school and in your internships that really make you stand out, for sure. What's the toughest challenge you faced and how did you navigate it? What did you learn? Definitely the toughest challenge I faced is opening my own business while I was working full time in my other job and having a family. There were a lot of tears and a lot of self doubt, but I sort of learned that those are the moments when people are successful, right? If success was so opening your own business and being successful were so easy, then everybody would do it, right? So it's those times where it gets really hard and you're upset, you're tired, and you just want to throw in the towel and give up. That's what most people end up doing. But in those moments, that's when you grow and you learn the most about yourself and you are successful, is when you push through those really tough parts of your life. And so once I sort of realized this, that, hey, if this was easy, everybody would be doing it. So that was the biggest learning experience for me. And I still, to this day, when I'm, you know, like right now, I'm trying to hire another nurse and I'm writing her contract, and I don't know how to write a contract for another provider. I'm just, kind of going online, doing research, doing using ChatGPT, and, trying to do this at night at 11 o'clock at night when I'm tired. Um, it's like the last thing I want to do, but I know that, the more providers that I hire, the more successful I'll be. And so you just kind of push through it. And I know that those are the moments that I will be most proud of, down the road. And hopefully, continue to grow a successful business. Not maybe all, but some things. And so a lot of patients of mine that I've seen over the years that spend time and resources doing things to make them feel better about themselves, those things trickle down into other parts of their lives. So that's the most rewarding. Um, what advice would you give a student or a nurse considering dermatology or NP school? I mean, dermatology is a wonderful profession, a wonderful field, and I think it's only going to keep growing and growing and growing. I mean, just in the last 20 years I've been doing it. I mean, I have patients who are 18 years old and I have patients who are 88 years old. So, there's so many different patients out there. Everybody wants to see a dermatologist. Everybody needs at some point to see a dermatologist. Um, and I just think it's a wonderful profession. And as far as being a nurse practitioner, you know, at the end of the day, I mean, my husband is a doctor and a surgeon, and he's the smartest person I know. I'm not even close to as smart as he is. But as a nurse practitioner, I can practice on my own. So I run my business. I don't need a physician. I can write prescriptions. I can see patients on my own. So I kind of feel like I get to kind of be similar to a doctor without having to go to residency and go to medical school. And like I said, granted, doctors are so much smarter than I am and have so many other things to offer. But I do feel like nurse practitioners do get to take advantage of the fact that they do get to see patients independently and prescribe and treat them without having to go to residency, right, go to medical school and do a residency. because that's a long time. That's like 8 years of your life. So, um, what kind of education and certificates did you need to become a derm NP? So just my bachelor's of science in nursing to become a nurse. I got that at Villanova, and then then a master's degree to become an NP in whatever field you choose. I got that at Johns Hopkins. And then dermatology, there's no specific, like you don't have to go to school specifically to become a derm NP. You go to school to be an NP. You pick, like, if it's acute care in the hospital, adult, geriatrics, peds. And then once you graduate, you kind of look and see what jobs are out there, whether it's, like, for me, it was plastics, it was cardiac, and it was transplant. And you kind of apply for jobs in fields where you think you want to work. And then once you take a job in that field, then there's like a 6-month training, where they train you kind of specifically in that field. Owning, let's see. I think that's it. There's a couple repeats at the end of the paper, but I think I answered everything, and I hope this was helpful. If you have any other questions, please just let me know. Bye, Riley.